So today we will discuss 3 clinical charts on different types of jaundice. Now if I ask you that since your liver function test class is over, can you enumerate the test performed in liver function? SGPT, SGOT, अच्छा, bilirubin, direct or indirect, totalটা নয়, আর total purin, albumin and globulin, তাই তো? What is the function, what is the test performed to assess the synthetic function of liver? Prothrombin time is done to assess synthetic function of liver. If I ask you, name the test used to assess excretory function of liver, total and direct bilirubin. How to assess the function of liver in carbohydrate metabolism? Galactose tolerance test. What are the contraindications for galactose tolerance test? মানে কোন পেশেন্টকে আমি গ্যালাক্টোজ টলারেন্স করাবো না? Galactosemia. What is the test performed to assess lipid metabolism? Ratio of cholesterol and cholesterol ester. Ratio of cholesterol and cholesterol ester. What is the test used to assess protein metabolism in liver? Blood ammonia, because ammonia is metabolized in liver. মাথা তো নালি, বলতো অ্যামোনিয়া থেকে কি তৈরি হয়? তুই বল, what is jaundice? Yellowish discoloration of skin, sclera and mucous membrane due to elevated levels of bilirubin in blood. Jaundice কে আমরা 3 ভাগে ভাগ করি. Divided in 3 types. One is hemolytic or prehepatic jaundice. Number 2 is hepatocellular jaundice, and number 3 is post-hepatic or obstructive jaundice. এবার দেখো এটা কি লেখা আছে, এই দেখো 9 নম্বর যেটা আছে স্লাইডটা, laboratory reports of blood and urine examination in a jaundice patient were as follows: serum bilirubin total 16.6 milligram percent, conjugated 14.8 milligram percent, unconjugated 1.8 milligram percent, serum alkaline phosphatase 100 Ka unit, SGOT 35, SGPT 35 units per liter each. In urine, bile salt present, bile pigment present, urobilinogen nil. Got it? So this is, what is your provisional diagnosis? Obstructive jaundice. How did you confer? Urobilinogen
নীল আছে, অ্যাবসেন্ট আছে।
আচ্ছা, ব্যাস আর কিছু হয়ে গেল?
কনজুগেটেড আর
Alkaline phosphatase has 2 units. One is this Ka unit, King Armstrong unit, the old one, and nowadays it is units per liter. In Ka unit, the normal level of alkaline phosphatase is 3 to 13 Ka unit. 3 to 13. So it is 100, it is almost 10 times, right? So it is very high. So if you consider 100 means now it will be here, it will be around 150 or 180 आसपास, normal up to 180 চলে যাবে যদি আমরা এখনকার ইউনিট পার লিটার যাই। So it is high. So first of all, we must see that whether the total bilirubin is high or not. How high? It should be more than 2.4 milligram %. Then only we can call it as clinical jaundice. If it is less than 2.4 milligram %, but higher than 1.5, then it is subclinical jaundice. It is subclinical jaundice. So it is way more than 2.4. So it is jaundice. What type of jaundice? How do you know? That if the conjugated bilirubin is elevated more compared to unconjugated, দেখো conjugate কি আছে 12 point something, whereas in unconjugated is much less. Unconjugated is also high than normal, but compared to conjugated is very less. So this is the first point, striking point, where we should go for the diagnosis of, yes, it is conjugated hyperbilirubinemia. It is jaundice and it is conjugated hyperbilirubinemia. Next we will see the enzyme. Which enzyme is most important to find out whether it is conjugated obstructive type C obstructive jaundice or not? That is alkaline phosphatase. That is alkaline phosphatase. So alkaline phosphatase is also high. So it is it is obstructive or post-hepatic jaundice. Now this particular clinical chart does not provide many information about the actual patient. Correct? There is no age, gender, correct? There is no other symptoms. Now this is not something for which the patient will come to you. Patient will come to you for some other reasons. What are those? There must be some pain abdomen, some discomfort, something wrong which is not good, but he is unable to tolerate. That's why he has come to you. Now how do you know? So here we have to remember several causes for this particular finding. As I told, this is not a disease, it's a symptom. Jaundice is a symptom. It may be generated due to many other diseases. So what are the different types of diseases you know? When I say obstructive jaundice, that means there is obstruction in biliary canaliculi, right? Means biliary tree. The liver is supplied with hepatic duct, then gallbladder is supplied by cystic duct. When they combine, they form CBD, and they enter through second part of duodenum through ampulle of water, right? And this region is masked by head of the pancreas, the duodenum part, the arch that is fitted with what? Head of the pancreas. So this is the anatomical situation. Now you tell me, what are different types of obstruction you can imagine? Number one, whether it is intrahepatic or extrahepatic. So if you perform USG, of whole abdomen, you will find what? Whether the block is at extrahepatic or not. So there is no blockade in the extrahepatic. That means it is due to intrahepatic. It is due to intrahepatic. So there are different causes for intrahepatic obstruction. There are different causes for extrahepatic obstruction. Okay. Let us start. First, you can say cholelithiasis. What is cholelithiasis? I am talking about extrahepatic. Cholelithiasis means what? Formation of stone in the biliary tree, biliary canaliculi. Yeah? Wherever there is a stone formation, there is a block, physical block. Next, if there is a carcinoma in the head of the pancreas, that means pancreas head is increased in size and it is compressing the CBD. So, head of the cancer of the head of the pancreas. What else? There might be outgrowth, tumor formation in the biliary tree. That means carcinoma of the biliary canaliculi. What else? Can there be any problem with liver itself? Alcoholic liver cirrhosis. है ना? Alcoholic liver cirrhosis. So, any block in the drainage system of the bile will lead to regurgitation of the bile into the blood, and that is why the old classification had this term called two types of jaundice. One is regurgitated jaundice and it is unconjugated jaundice টাকে বলা হতো, আমরা মনে পড়ছে না, যাও hemolytic jaundice আর কি, ওটার নাম আছে একটা রিটেনশন জন্ডিস, একটা হচ্ছে রিগার্জিটেশন, একটা রিটেনশন জন্ডিস, দুটোই আর দিয়ে, একটা হচ্ছে রিটেনশন জন্ডিস আর একটা হচ্ছে রিগার্জিটেশন জন্ডিস। এটা কোনো রিগার্জিটেশন মানে যেতে পারছে না বলে ব্যাক ফ্লো করছে, তাই কনজুগেটেড বিলিরুবিন ইজ হাই। হলো। ইন্ট্রাহেপাটিক কি হতে পারে? হেপাটিক কার্সিনোমা হতে পারে। আমি খালি কনজুগেট বলছি, কনজুগেট কোন 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 বাড়তে পারে। আচ্ছা, ভাইরাল হেপাটাইটিস বলেছি, অ্যালকোহলিক সিরোসিস, লিভার সিরোসিস হতে পারে, অ্যালকোহলিক লিভার সিরোসিস, ঠিক আছে। আরেকটা খুব কমন কজ হয়, there are at least more than 20 causes, but at least you must remember 5-6 important causes. One of them is, most importantly, is there any history in the patient of having earlier any treatment of malaria? So, যখন তোমরা ক্লিনিক্যাল কেসগুলো পাবে, as you receive the clinical cases during examination, then some or other types of history points will be given. So, you must know which point to be looked at. So, if there is a history of malarial treatment, that means anti-malarial drug has been given. What are the drugs? Chloroquine, primaquine. These drugs causes intrahepatic obstruction. So, if there is a history of multiple bouts of malaria, that means he has undergone treatment also, that means he might have intrahepatic obstruction. Might have intrahepatic obstruction. Now, extrahepatic obstruction can be diagnosed by ultrasonography. How would you diagnose intrahepatic obstruction? PTC, percutaneous transhepatic cholangiography. Do you have any idea about angiography, angioplasty? You have? Hey, you have idea of angiography and angioplasty? Well, what is angiography and what is angioplasty? Done for the heart means what is done? That is my question. One part of the bolo bolo? Huh? Angiography? Achha, then what is plasty then? Did you choose this course on your own or somebody forced you to do so? Answer my question. It was your choice or your parents? Huh? I doubt. You are telling lie in front of everyone. You are very glad. If you have taken this by your choice, angiography and angioplasty, everyone knows, even he knows. Tell. See, bolo. You. তুই সামনে বসে আছিস, হ্যাঁ বল কতবার এদিকে তাকাবি, বসে বসে বল না। অ্যাঞ্জিওগ্রাফি অ্যাঞ্জিওপ্লাস্টি বল, সেটা হ্যাঁ আরে উইথ সাচ অ্যান conviction I told you will know. I mean, তুই বল বল। আরে তোকে জিজ্ঞেস করছি। হ্যাঁ হ্যাঁ তুই দাঁড়া, দাঁড়িয়ে থাক, স্ট্যান্ড আপ। You know the answer? Angiography and angioplasty? No, keep standing. কি বল? ক্যামেরা হিসেবে গ্রাফি মানে ফটোগ্রাফি নেওয়া, দেখা, টু সি, টু এক্সপ্লোর the coronary arteries, inside of the coronary arteries. Whether is there any block, is there any something is there or not? Right? Is there any plaque formation is there or not, to find out. And plasty means to remove and reconstruct that area. So if when you remove the plaque, it will squeeze, so it will form a stricture, the artery. It will lose its plasticity, elasticity, right? So then you put one stent, which is a metal pipe inside. So it will not allow the artery to again collapse. So that's how it's called plasty, and this is called angiography. To see angiography, like ultrasonography, to see graphy, to see photograph. Similarly, a small camera is inserted into the liver to see where the block has happened. And then it is very carefully removed and jaundice is cured. This type of intrahepatic jaundice is very commonly found in elderly people. Means your grandfather, grandmother, they. And it is usually done by using laparoscopic surgery. Small holes are made and through which 3 probes are entered, and one probe will see, one probe will clear that. It's very difficult surgery because there is a high risk of perforation of the hepatic ducts, and if it happens, the next good thing is you will receive your ancestral property. your grandfather will die, you will receive your ancestral property. This is a joke, you can laugh. Okay? I am not that serious, but you study. If you don't study, then it's not good. Fine? So this is how we know. Now, finding of bile pigment in the urine, urobilinogen, may be seen in all sorts of jaundice. One is due to overflow, another is due to increased soluble fraction. Right? But what is striking here? In the obstructive jaundice, the stool will be, yes, clay color. What is the color of stool? Clay. Hey. Grey. Baba, what animal you are? Hey, you are not human being. Yes, it is slightly here, pale yellow. Baba, grey bollo. Merechi. Yeah. So usually that is starcobilin, starcobilinogen, more precisely starcobilinogen. When we do not clean the stool, say for 3 to 4 hours, then the stool color becomes what? Yeah, you have seen that? Like brownie, same color. That is starcobilin, correct? A brown color, right? So that color is missing. Moreover, if you pour water also, that stool will not be completely cleaned from the pan. Why? Because it is full of fat, it will be sticky. So sticky stool, fatty stool, clay color stool. All these things will be there definitely for any kind of obstructive jaundice. And if there is any problem with the liver, say liver cirrhosis kind of thing, then the patient will definitely complain about indigestion and gastritis. Right? Next. 8 number 8. Serum bilirubin. Total 12.6. Conjugate 0.6, unconjugated very high 12, 9, SGOT, SGPT normal. What is the normal level of SGOT and SGPT? 5 to 40, 5 to 40 units per liter, units per liter. মুখস্থ রাখতে হবে, কি রাখতে হবে? কেন? তাহলে বাকি সব নর্মাল, বাইল সল্ট ইউরিনে নীল, যদিও নীল বলেছে কিন্তু এরকম নীল হয় না, ওটা পাওয়া যায়। হ্যাঁ, কেন পাওয়া যায়? ডিউ টু ওভারফ্লো, মানে এত বেশি তৈরি হয় যে ওখানে পাওয়া যায়। কিন্তু স্টুলের কোনো পরিবর্তন হয় না, যে ইউরোবিলিনোজেন পাওয়া যাচ্ছে, ইউরোবিলিনোজেন বাইল সল্ট বাইল ওটা ইউরোবিলিনোজেনটা পজিটিভ হবে। আচ্ছা, এবার দেখো হোয়াট আর দ্য কজেস ফর আনকনজুগেটেড হাইপারবিলিরুবিনেমিয়া। Hemolytic jaundice. Hemolytic jaundice means কি কি কারণ হতে পারে হিমোলাইসিসের? কেন? What are the different causes for increased breakdown of RBC? কি? স্নেক বাইট, হিমোলাইসিস হয়। আর ইনকম্প্যাটিবল ব্লাড ট্রান্সফিউশন, তাই না? একজনকে ও পজিটিভ, তাকে এ পজিটিভ ঢুকিয়ে দিল, কি হবে? কিছু হবে না। এ কে বি দিলে অসুবিধা হবে। মনে রাখতে হবে তো এগুলি, তাই না? তাহলে এখানে ইনকম্পাটিবল ব্লাড ট্রান্সফিউশন, থ্যালাসেমিয়া, অ্যানিমিয়া, right? Low hemoglobin may give rise to hemolysis, correct? Sickle cell anemia, আচ্ছা, হ্যাঁ বলো, হ্যাঁ, ম্যালেরিয়া হতে পারে, any cause which can, anything which causes hemolysis, তাই না? যদি তুমি আনট্রিটেড ম্যালেরিয়া থাকে, yes, you will suffer. Overall thing is there will be overproduction, very high amount of bilirubin will be generated, and our liver usually can cope up with the bilirubin content. But when this kind of high bilirubin is generated, then it superflows the capacity of the liver. So liver cannot cope up with that much of bilirubin. Liver cannot cope up with that much of bilirubin. So that unconjugated bilirubin gets excreted in urine. Correct? Although it is not water soluble. Because it is overflowing, so it will appear in urine. So these are the causes where you find this thing. There are many other causes, I will come later. Let me finish the third one. Third one is very difficult one. These two are good. Okay, one more. G6PD-H deficiency may also cause hemolytic jaundice. G6PD-H deficiency. G6PD-H deficiency. Hereditary spherocytosis. Hereditary spherocytosis. है ना? अच्छा, usually क्या है? मेয়েদের হয়. Usually girls are affected. G6PD deficiency. আচ্ছা, এটা কোথায় গেল? হ্যাঁ, so again in this number 7, serum total bilirubin is 9.8, conjugated 5.3, unconjugated 4.5. Alkaline phosphatase, AST, ALT all are normal level. Bile salt present, bile pigment present, urobilin present. All are positive in urine. Okay? No issues. What is the problem here? Somehow both the bilirubin conjugated as far as unconjugated, both are increased. That means something is wrong where normal. AST ALT বাড়বে, ভাইরাল হেপাটাইটিস হলে বাড়ে। হ্যাঁ, ও হ্যাঁ বেড়েছে, হ্যাঁ বাড়বে, সরি বাড়বে, আমি অন্যটা দেখছিলাম, ওটা বাড়বে। আচ্ছা, ডিটেলস আসছে। সো AST ALT will be little elevated. It should be, আচ্ছা fine, we'll come to that. 10 to 15 times minimally. আচ্ছা, now what are the different causes? Anything that damages the normal hepatic parenchyma. Anything that damages normal hepatic parenchyma. It is cirrhosis of liver, correct? It is due to viral hepatitis. It is due to infection of the liver cells. It may be due to alcoholic cirrhosis. It may be due to non-alcoholic cirrhosis. Alcohol is not the only thing which can causes cirrhosis. There are plenty of many among us. হ্যাঁ কি বলছিলাম, তাহলে দেখা যাচ্ছে nowadays it has been seen non-alcoholic fatty liver is more prominent than alcoholic fatty liver among the urban dwellers, শহরে যারা থাকে তাদের মধ্যে। তার কারণ কি, মোস্টলি ইট ইজ ডিউ টু accumulation of fat. So fatty liver is one of the cause of cirrhosis. So that might cause damage, irreversible damage to the hepatic parenchyma. Now, what are the other genetic causes for these types of jaundices? Have you heard of Gilbert syndrome? Type 1, type 2. So Gilbert syndrome is characterized by unconjugated hyperbilirubinemia. Okay? And what are, name some conditions where there is elevated conjugated level of bilirubin? For example, Dubin-Johnson, Rotor, Kriegler-Naja, they lead to conjugated hyperbilirubinemia. So remember these names also. Questions may come even picking up these names and these items. Okay. So anything that can cause hemolysis you should know, and that may lead to hemolytic jaundice. Jaundice we will call only then when the total bilirubin level will be more than 2.4 milligram per cent. Below that we shall consider as subclinical jaundice, because beyond that only bilirubin will appear in sclera. Sclera means the white portion of the eye. Right? Then carcinoma of the liver, carcinoma of the biliary tract, carcinoma of the pancreas, anything may lead to jaundice, conjugated hyperbilirubinemia. Conjugated hyperbilirubinemia. It may vary. Suppose cancer, if cancer takes place in a particular region where it affects the drainage of the hepatic biliary tract, then it will cause obstruction. If not, then it will reduce the conjugation process and unconjugated will be high. Do you understand what I said? Suppose a cancer takes place in an area which obstructs the bile drainage from the liver, then it will cause post-hepatic jaundice. If it occurs, cancer takes place in an area of liver where the hepatic parenchymal cell is damaged and it cannot contribute to the conjugation of process of the bilirubin, so unconjugated bilirubin will be more. Alright? That's all. এই তিনটে পড়বে এবং অবশ্যই মনে রাখবে পরীক্ষা কিন্তু এরকম ফ্ল্যাট কোশ্চেন নাও আসতে পারে। They might ask you in association with any of the diseases I named, any of the diseases. So you should be having idea about Gilbert syndrome, Dubin-Johnson, Rotor, Kriegler-Naja. You have to remember the names. You have to remember the conditions. Infective hepatitis. There are two types of infection, viral and bacterial. Viral means it will be hepatitis A, B, C, anything, correct? Bacterial means when there is a bacterial infection. It may also occur, correct? So these two will be different. So there are differential diagnosis for these two diseases, but symptoms will be same. It will lead to conjugated hyperbilirubinemia. So questions when the clinical case will come, first thing you must notice whether it is showing increase in conjugated bilirubin or unconjugated bilirubin. If it is showing increase in conjugate bilirubin, then your diagnosis should be about post-hepatic. So think about the reasons for post-hepatic. Find out what are the these points are there or not. Any one of these points, which may lead to post-hepatic jaundice. If there is increment in the unconjugated bilirubin, then try to find out, look out for the points which may lead to hemolytic jaundice. Correct? So, and if it is hepatocellular, then the patient might come with fever. Why? Because bilirubin, accumulation of bilirubin in the body causes hyperthermia. জ্বর আসে. So viral hepatitis may express with fever. So that is the point. Now you see both the things are increased, both conjugated and unconjugated. Then if the liver is affected, then liver enzymes will be affected. Liver enzymes will be affected. That means AST and ALT. How many times? At least 10 times. Then only we can call it, yes, it is due to jaundice. If it is below 10 times, it may not be due to jaundice. And alkaline phosphatase is a key enzyme to rule out obstructive jaundice. If there is any obstruction, whether it is intrahepatic or extrahepatic, ALP will be high. If ALP is normal, forget about, but make sure to see the age of the patient. Is the patient minor? Then alkaline phosphatase usually normally will be little higher than the adult, because the growing children and pregnant lady will show usually little high alkaline phosphatase. So that might cause little bit of interference in a diagnosis. Correct? So that you must look out. Then drug-induced conjugated hyperbilirubinemia. That patient will come that after taking certain drug, he has expressed these kind of symptoms. This is called drug-induced cirrhosis. One of them is primaquine, anti-malarial drug. Right? That's all.